let's talk about QuickSplints and how we use QuickSplints. So QuickSplints for me actually have transformed my practice. So they can be a diagnostic tool, they can be a therapeutic tool, they're a patient education tool. So as part of the JAMS protocol, we talk about using a QuickSplint as a management device. We can make it for a patient and we can have them use the device before an appointment to start to minimize the risk that they're going to develop JAMS. For moderate and high-risk patients, we're going to make them a QuickSplint and we're going to send it home with them as part of their management strategy so that they're actually helping themselves not develop that joint or muscle sprain or strain. I also want to think about the QuickSplint as a diagnostic tool and as a patient education tool. So when I say diagnostically, that's really about what I learn and what the patient learns. And so one of the things that I always do when I make a patient a QuickSplint is I ask them to bring their QuickSplint with them when they come back for their follow-up appointments. When they bring that appliance back for that follow-up appointment, we're going to look at it together. And I will tell you actually one of the first things that I do is I ask the patient, how have you been doing with your QuickSplint? And I know that sounds like a pretty broad, open-ended question. And I do it that way with intention because I want them to actually share with me their experience. So they'll tell me if I ask that question, how much they're wearing it. I actually wore it every day, or I wore it every night, but I forgot one time, or I wore it every night, but I sometimes find it on my pillow. So because it's open-ended, I get a lot more information than if I simply say to them, have you worn your QuickSplint, where you get yes or no. The other thing that it's my experience is when I ask a patient, how have you been doing with your QuickSplint? How many of my patients will actually reach in their purse or reach in their pocket and take out the little plastic cylinder and pop the QuickSplint out, and they'll hold it up to me and go, look what I did to it. And that for me is part of the diagnostic patient education piece. They now know they're rubbing their teeth against the plastic. It's really easy now to have a conversation with, that's incredible learning for both of us, that you're actually grinding your teeth against this, or you're clenching it because they make little divots with the cusp tips of their canines. And then we get to launch into a conversation about now how we manage that moving forward. So if somebody actually is learning, and we're learning together, that they're parafunctioning against their QuickSplint, that for me is a great opportunity to now move into the concept of a parafunction protection device or a long-term appliance. And is this person going to benefit from long-term appliance therapy, and how that will help them not only in the future minimize their risk of JAMS moving forward at future dental appointments or future life experience, as well as maintaining their teeth. So one of the things about a QuickSplint is not just to use it as a therapeutic device, but really to think about it as a way that both you and the patient can learn about what they're doing with their teeth at night that's a contributing factor to them developing JAMS.